All right, ready to dive deep?
Solid.
Today, it's all about obesity and type 2 diabetes.
Big topic.
Huge, and we're going straight to the source. The American Diabetes Association's 2025 Standards of Care in Diabetes.
Oh, that's the Bible for healthcare professionals working with diabetes.
Exactly. Evidence-based, cutting-edge stuff, so...
We know we're getting the good stuff.
Exactly. And our mission today is to break it all down for you.
Help everyone listening.
Yes, help you understand how to manage weight to prevent or even treat type 2 diabetes.
This is covering it all.
Everything from how obesity is even assessed.
Right, not as simple as it sounds.
Nope. Then we'll hit those lifestyle changes.
Crucial.
Then the role of medication.
Another big one.
And we'll even touch on surgery if we need to.
Gotta be thorough, right?
Absolutely. We're going for a complete picture here.
Sounds good, and I think a lot of people might be surprised by how we even define obesity these days.
Oh, really? I'm intrigued. Tell me more.
So, we've all heard of BMI.
Body mass index, yeah.
Right, and for a long time it was the metric.
So what's changed?
Well, the source really challenges this idea that BMI is the be-all and end-all.
It's not enough.
It's important, don't get me wrong, but it's just one piece of the puzzle.
Ah, so there's more to the story.
Way more, like where your body fat is distributed.
Oh, like apple shapes versus pear shapes.
Exactly. That waist circumference is a big indicator.
And we can all measure that at home, right?
Easy peasy. Just grab a tape measure.
So BMI plus waist circumference.
And we can't forget any weight-related health issues.
Oh, right, like high blood pressure, joint pain, things like that.
All those factor into the
Okay,
equation.
so it's a much more holistic view now.
Absolutely. We're not just looking at a number on a scale.
We're considering the whole person.
Precisely. Because that's what leads to a personalized plan.
Makes sense. A plan that actually works for you.
Exactly.
All right, so once we've got a clear picture of our health, where do we go from there?
Well, the source is crystal clear. Weight management.
It's that important.
Crucial when it comes to treating type 2 diabetes.
Wow. Okay, so what's the magic number? How much weight do we need to lose?
Well, the good news is even a little bit goes a long way.
Really? Like, how much are we talking?
Even losing 3% to 7% of your body weight can make a noticeable difference.
Seriously? Just that small amount?
Yep, you could see better blood sugar control, maybe even reduce your medication.
Okay, that's definitely motivating.
It's huge, but it gets even better.
Oh, there's more.
If you can hit that 10% weight loss mark,
10%.
that's when things get really exciting.
All right, I'm on the edge of my seat. Spill the beans.
We could be talking diabetes remission.
Wait, like it goes away?
Essentially, your blood sugar levels are back to normal.
Wow, okay, what else?
Lower risk of heart disease, and you might even live longer.
Seriously? Just from losing weight?
It's amazing the power we have over our own health.
I'm sold. Sign me up. So how do we actually make this happen? What does the source recommend?
Well, the foundation is, you guessed it,
Lifestyle changes.
bingo. The source really hammers this home. Nutrition, physical activity, and, get this, behavioral therapy.
Behavioral therapy, that's not something you usually hear about with weight loss.
Right, but it's so important.
I guess I don't really think about the mental and emotional aspects.
That's exactly what it addresses. It helps you understand your eating habits, those triggers that make you reach for the cookie jar.
Oh, I know those triggers all too well.
We all do, but behavioral therapy gives you coping strategies.
So you can actually make lasting changes.
Exactly. And the source actually recommends structured programs.
Like those intensive weight loss programs we hear about.
Yeah, they suggest aiming for a program with lots of counseling.
Like how many sessions are we talking?
About 16 sessions over 6 months. Pretty intense, right?
That is a lot. And they have a specific calorie target too, right?
You know it. 500 to 750 calorie deficit per day.
So you could lose like a pound a week just from that.
Potentially, yeah. But the source also acknowledges that not everyone has access to these fancy programs.
Yeah, they can be pretty pricey.
And that's where it gets interesting. They suggest looking into other options.
Like what?
Maybe an online program or something local in your community.
Something more affordable, maybe?
Exactly. The key is finding something structured, something that provides support.
Because going it alone is tough.
So tough. We all need that extra help sometimes.
Okay, so we've talked about the big picture, but what about the nitty-gritty of diet? Did the source have anything to say about that?
Oh, definitely. And you might be surprised by what they recommend.
Oh, duh it on me. What's the scoop?
You know how everyone's always obsessed with finding the perfect diet? Low carb, high fat, all that.
Yeah, it can be overwhelming.
Totally. But the source says focusing on creating an energy deficit might be even more important.
Wait, so it's not about what you eat, but how much you eat.
More about that overall calorie intake, yeah.
Interesting. So maybe it's less about cutting out entire food groups
It's not about deprivation, it's about making smart choices.
and still enjoying your food, right?
Exactly. But of course, making healthy choices is still super important.
So there are some foods we should be limiting.
The source is pretty clear about cutting back on processed and ultra-processed foods.
Ah, those prepackaged meals, chips, sugary drinks.
Yep, all those can really sabotage your efforts.
Okay, so it's all about balance, right? Not depriving ourselves, but being mindful.
Exactly. And here's another really important point the source makes.
I'm all ears.
It's all about personalization. What works for one person might not work for another.
Oh, right. We're all different.
Exactly. Your background, your culture, your preferences, even your lifestyle.
All that factors into choosing the right way to eat.
Your perfect diet might look totally different from mine.
So it's about finding what's sustainable for you long term.
Absolutely.
Yeah.
It's not about a quick fix. It's about a lifestyle change.
It's about making changes that you can actually stick with.
Now you're getting it.
Okay, so we've got this whole long-term change thing going on.
Sensing a theme.
Definitely. So tell me, what's next? So it's about playing the long game.
Absolutely. We're not looking for quick fixes here.
We want those changes that really stick.
Exactly. So reaching that initial weight loss goal, that's great. That's a victory,
It's a good starting point.
for sure. But the real challenge is keeping it off.
Oh, I hear that. It's like running a marathon, not a sprint.
Perfect analogy. It's about that long-term commitment.
So how do we stay on track? What's the secret sauce, according to the source?
Well, ongoing support is key, even after you've hit your goal.
So we still need that cheerleader in our corner.
Exactly. Think of it like a support system, people who keep you accountable.
I guess it's easy to slip back into old habits.
It happens to the best of us. That's why the source recommends programs with regular check-ins.
Like, how often are we talking?
Ideally, monthly contact is a good target.
Okay, so staying connected is important.
Crucial.
Hmm.
And they also emphasize self-monitoring.
Oh, like tracking your progress.
Exactly. Good old-fashioned weekly weigh-ins can be helpful,
I can see how that would keep you honest.
right? Or even keeping a food diary.
Writing down everything you eat. Ooh, that sounds tough.
It can be eye-opening for sure. And then there are those fancy wearable fitness trackers.
Oh, yeah, everyone's got one of those these days.
They can be super motivating. And of course, we can't forget physical activity.
Gotta get moving.
Aim for 200 to 300 minutes per week. Sounds like a lot,
It does.
but it could be just 30 minutes most days. Totally doable.
Definitely more manageable than I thought.
Right. It's all about finding what fits into your life.
Making it sustainable.
Exactly. Now, the source does mention something called structured, very low-calorie meal plans.
Oh, yeah, those are pretty popular.
They can be helpful for some people, especially those who need a little extra boost.
Like a jump start.
Exactly. These plans usually range from 800 to 1,000 calories per day.
Sounds pretty restrictive.
It is, and that's why there's a big caveat here.
I bet it involves a doctor.
You know it.
Yeah.
These plans should only be used under medical supervision.
Safety first, always.
Absolutely. Now let's talk about something I know a lot of people are curious about. Hit me with it.
Medications for weight management.
Oh yeah, there's a lot of buzz about those.
There is, and the source encourages considering them, but not as a replacement for lifestyle changes.
So it's not a magic bullet,
Definitely not. Think of medication as more of a tool in your arsenal.
like a teammate on your journey.
Love that analogy. And there are some exciting new medications out there.
Oh.
Like what? GLP-1 receptor agonists, for one.
Those are the ones that help with blood sugar too, right?
Exactly. And then there are dual GLC and GLP-1 receptor agonists, even newer.
What are those like?
Think semaglutide or tirzepatide. They're making waves.
I've heard of those. They're pretty effective, right?
They can be, and they have multiple benefits.
Wait, so they do more than just help with weight?
Yep. They also improve blood sugar control and cardiovascular health.
Wow, that's impressive, like a triple whammy.
Pretty much. But of course, we have to remember all medications have potential side effects.
Right, there's always that risk.
That's why it's so important to talk to your doctor. Get that personalized advice.
Exactly. They can help you weigh the risks and benefits.
Find what's right for you.
Precisely. And here's another little nugget from the source.
Okay, I'm ready.
If you're taking medication for another condition, talk to your doctor about whether there are alternatives.
Oh, interesting. Like some medications might cause weight gain.
Exactly. So see if there are options that are more weight-friendly.
That's a good reminder to be proactive, advocate for yourself.
Absolutely. Now let's tackle a topic that can be a bit sensitive:
I think I know where you're going with this.
metabolic surgery.
The big guns.
It's often seen as a last resort, but for some people, it can be truly life-changing.
The source actually recommends it for certain individuals, right?
Yep, those with a BMI of 30 or higher, or 27.5 or higher for Asian Americans.
And who haven't had success with other methods.
Exactly. It's not for everyone, but for some, it can be a game changer.
And the source gets pretty specific about the types of procedures, right?
And they do. They talk about gastric bypass, sleeve gastrectomy.
Those are the most common ones, I think.
They are, and they explain how they work, the potential benefits.
So what are some of the key takeaways about surgery?
Well, first off, it can lead to substantial weight loss,
Like a lot of weight.
potentially a significant portion of your excess weight.
Wow, that's huge. But it's not just about the number on the scale, right?
Right. It's about the impact on your overall health.
Like blood sugar control, maybe even diabetes remission.
Exactly. But of course, there are serious considerations too.
It's major surgery. There are always risks.
Absolutely. And the source stresses the need for long-term support after surgery.
So it's not a one and done deal.
Nope, it's a journey, and
Yeah.
you need that medical and behavioral support.
Stay on track.
Exactly. And there's also the importance of monitoring for nutritional deficiencies.
Oh, right, because your body's absorbing nutrients differently after surgery.
Precisely. And there's always the possibility of complications.
So it's about going into it with your eyes wide open.
Being informed and prepared.
Knowing it's a commitment, not a quick fix.
Exactly. And speaking of commitments, there's one thing this source highlights that I think is super important.
What's that?
It's the mental and emotional side of things.
Oh, right. It's not just about the physical changes.
Exactly. Like, think about someone considering metabolic surgery.
Okay.
The source says they should be evaluated for any underlying psychological conditions.
Makes sense. It's a big decision.
Huge. And they also need to consider their support systems.
Having people to lean on.
Absolutely, because all those factors can really affect how well someone does after surgery.
So it's not just about the physical, it's about the whole person.
Exactly. And it's not just for surgery either, you know?
Really?
The source recommends routine mental health screenings for anyone who's had metabolic surgery.
Wow. Okay, so it's ongoing.
It should be. And access to behavioral health professionals is key.
So we're talking therapists, counselors, that kind of thing.
Exactly, because again, it's about the whole person, not just the physical.
I like that. Taking care of our mental well-being along the way.
Absolutely. And here's one final point the source emphasizes.
Lay it on me.
Even after you've reached your weight loss goal, the journey isn't over.
Wait, so it's not like mission accomplished, I'm done.
Nope. Regular monitoring is key, even after you've hit that target.
Why is that? I mean, once you've lost the weight, isn't that it?
Well, weight can fluctuate.
Oh, right. Life happens.
Exactly. Stress, holidays, vacations, it can all throw you off track.
So checkups are still important,
Absolutely. The source recommends checkups every 6 to 12 months.
just to make sure things are still going well.
Exactly. If you've gained some weight back or haven't lost as much as you hoped.
There's still time to adjust the plan.
Exactly. Maybe revisit those lifestyle strategies, consider medication.
Or even explore other options.
The key is staying engaged and proactive, even after you've hit those initial goals.
So it really is a lifelong commitment.
To your health, absolutely.
Wow, we've covered a lot of ground today.
We have. From how obesity is assessed, to all the ways to manage weight.
For preventing or treating type 2 diabetes,
We talked lifestyle changes, medications, even surgery.
it's been a real deep dive.
Into a really important topic.
It has, and as we wrap things up, we want to leave you with something to think about.
Something to ponder.
Based on everything we've learned, what one action are you inspired to take right now?
To start, or maybe even improve, your own weight management journey.
It could be something small, like measuring your waist circumference.
Or scheduling a checkup, maybe even trying a new healthy recipe.
Whatever it is, take that first step.
You got this.
Thanks for joining us for this deep dive.
See you next time.